Microgestin Tablet is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, this birth control pill can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. It's recommended to take this medication at the same time every day to ensure its effectiveness. Consult with your healthcare provider for the best time to take this medication and the appropriate dosage for you. Before you start taking Microgestin Tablet, make sure to read the patient information leaflet provided by your pharmacist. This contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Follow the directions for your brand. It is very important to continue taking this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important that you follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Check with your doctor or pharmacist for more details. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Ask your doctor or pharmacist if you have any questions. Your pill pack contains 21 pills with active medication. It may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you are switching from other forms of hormonal birth control, consult the patient information leaflet, or your doctor or pharmacist if any information is unclear. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change, these are common side effects of Microgestin Tablet. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to note that this medication may raise your blood pressure, so it's recommended to regularly check your blood pressure and inform your doctor if the results are high. Serious side effects can include lumps in the breast, changes in mood such as worsening depression, severe stomach/abdominal pain, and unusual changes in vaginal bleeding. Additionally, this medication may rarely cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience symptoms such as chest pain, confusion, sudden dizziness, or trouble speaking, seek medical help immediately. While a serious allergic reaction to this drug is rare, Seek immediate medical help if you experience symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you observe any other effects not listed, it's important to contact your doctor or pharmacist. If you are over 35 years old and smoke cigarettes, you should not use Microgestin Tablet. Smoking while using this medication can increase your risk of stroke, heart attack, blood clots, and high blood pressure. This risk becomes even greater with age and the amount of cigarettes you smoke. It is important to avoid smoking or using tobacco products while taking Microgestin Tablet. Before taking Microgestin Tablet, it's important to inform your doctor or pharmacist if you have any allergies to estrogens or progestins, or if you have a history of certain medical conditions such as blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, obesity, or thyroid problems. If you have diabetes, this medication can affect your blood sugar levels, so it's important to monitor your blood sugar regularly and discuss the results with your doctor. Chewable tablets may contain sugar and/or aspartame, so if you have diabetes or phenylketonuria, use caution. Let your doctor know if you are planning to have surgery or if you will be confined to a bed or chair for a long time, as these conditions can increase your risk of blood clots while using hormonal birth control. It's also important to inform your doctor or dentist about all the products you use before having surgery. Microgestin Tablet may cause blotchy, dark areas on your face and skin, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contact lenses, so contact your eye doctor if these problems occur. After stopping birth control pills, it may take longer for you to become pregnant, so it's important to consult your doctor if you are planning to become pregnant. This medication should not be used during pregnancy, and if you become pregnant while using it, inform your doctor immediately. Additionally, if you are breastfeeding, consult your doctor before continuing to breastfeed while using this medication. When taking Microgestin tablets, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's essential to consult your doctor before starting, stopping, or changing the dosage of any other medicines. Certain drugs, such as aromatase inhibitors, fezolinetant, and tamoxifen, may interact with microgestin, potentially affecting its effectiveness. Additionally, some medications can decrease the amount of birth control hormones in the body, leading to a decreased effectiveness of hormonal birth control. Examples of these drugs include griseofulvin, modafinil, and certain HIV medications. If you start any new drug while taking microgestin, it's crucial to inform your doctor and discuss whether you should use additional reliable birth control. It's also important to notify your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that the birth control is not working effectively. Furthermore, microgestin may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much microgestin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. In the US, you can call 1-800-222-1222 for your local poison control center, while Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Remember, it's important not to share Microgestin tablet with others. It's important to have regular physical exams and medical tests while taking this medication, including blood pressure checks, breast exams, pelvic exams, and pap smears. Make sure to follow your doctor's instructions for examining your breasts, and report any lumps right away. Be sure to keep all of your medical and lab appointments. And if you have any questions, consult your doctor for more details. If you miss a dose of Microgestin tablet, refer to the product package for guidance on what to do. It's important to use backup birth control, such as condoms or spermicide, to avoid pregnancy. If you have questions, be sure to ask your doctor or pharmacist. If you find that you frequently forget to take your pills as directed, it may be a good idea to talk to your doctor about switching to a different form of birth control. Remember, consistency is key when taking this medication. Make sure to store your Microgestin tablet at room temperature, away from light and moisture. It's important to keep it in a safe place, away from children and pets. When it comes to discarding the product, make sure to consult your pharmacist or local waste disposal company for the proper way to dispose of it when it's no longer needed or expired. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.